here as always with Dr. Nario of Biointegrative Health Center. Thanks for being with us, Doctor.
Hi, Steve. Thank you for having me. Always a pleasure.
I want to talk about triglycerides today. Triglycerides is a big deal marker, right? It's something that you get tested with your blood work, but it's something that people should be paying attention to, right? I mean, what are triglycerides?
Well, Steve, that is definitely a good topic of discussion for today because there's a lot of misconception about triglycerides. And again, triglycerides are a type of fat found in your blood. And when you eat, your body converts any calories it does not need to use it the right way. And that storage form of calories is what we call triglycerides. And triglycerides are stored in your fat cells. Later, hormones release triglycerides for energy between our meals, and if we need to use it for other the physical demanding activities, it will be there for it to be available. So if you are regularly eating more calories than you burn, particularly from high carbohydrate foods, you may have high triglycerides. So why it's usually not the fatty food that's the cause of it, but it's mostly the carby food. That's why we have to make sure that everybody knows that, so that that correlation that fat equals triglycerides is now going to be carbs equals triglycerides.
Yeah. And so I know that it's not good to have high triglycerides. I used to have them about 7, 8 years ago before I tweaked my diet a little bit. But what are the dangers of having high triglycerides?
Well, Steve, with high triglycerides, as you have, if you remember my, I guess, comparison, that triglycerides is also fat found in your blood, in your tissue. If they're running in your bloodstream, you have to remember that they can now turn into plaque or blockage. So that's why it's the same risk factor in relation to having high cholesterol or bad cholesterol, to be more specific, that it can lead to blockage and inflammation. And triglyceride levels increases the risks of heart attacks, vascular disease like blockages in your carotids, blockages in your heart blood vessels, specifically heart attacks, and even now making you more prone to hypertension, diabetes, obesity, and even strokes. And that's why when we talk about triglycerides, this is really something that now comes into more of a comparison to the same risks of having high bad cholesterol.
So, can you get into a little more of the specifics? You touched on it a little bit on what are the things that cause high triglycerides?
Well, Steve, there's so many. The thing here is one thing that I want to point out there is actually maybe three. Let's cut it down to three. So one, lifestyle factors, especially diet. Extra calories into turns into triglycerides. So if you're consuming sugars, fats, alcohol that your body does not use in the right way, your triglycerides can go up. Eating too many refined carbs like white bread or sugars, I'm sorry to be the bearer of bad news here, and eating too much saturated fat and not moving around enough, sedentary lifestyle. So the past winter was really kind of notorious for this. And drinking too much alcohol is also another risk factor. So you have to remember triglycerides is almost like carbs that we're trying to utilize, but we don't have storage for excessive carbs. That's why they get stored into fat eventually. So thus, again, the chain reaction of cholesterol, bad cholesterol, now to turning into triglycerides. And the other not common reasons would be medications. If you're using a diuretic, being on steroids, and blood pressure medicines as well, like beta blockers, as we call them, and rarely, very rarely, genetic disorders, which I've seen. I drew blood one time, and the person who has so much triglycerides in their blood, it's like pure white. It's like goo, and you can't even
Wow.
suck it out.
Wow. That's all very interesting on some of the things that can raise the triglycerides, which are a big deal. So, you kind of touched on it a little bit on what causes it, But can you give us some specifics on how to bring it down, related to what you just said?
Right. Well, Steve, conventionally, the meaning using medications, fibrates, you're going to be hearing a lot about that. And it enhances the clearance of triglycerides because we stimulate specific enzymes to destroy that. And it lowers triglycerides stored in the liver, thus lowering the transfer in the blood. But nothing beats, again, healthy lifestyle choices, exercising regularly, at least 30 minutes of physical activity, and almost every day if you can, and but not too intense throughout the week. And again, avoiding sugar and refined carbs, simple carbs, sugars, specifically, and things that are made from white flour and fructose. We have to lose weight, people. Extra calories are converted to triglycerides and being stored as fat. We have to choose in our diet also healthier fats. These are, again, saturated fat found in meats, for healthier fat found in plants. These are the things that we need to weigh because plants actually has more benefit. And these are the examples of such would be olive oils. Instead of also red meat, try fish high in omega-3 fatty acids, such as mackerel and salmon. And avoid trans fats or foods with hydrogenated oils, again, and dangerous fats. And limit alcohol drinking. So much for the partying, right? Well, alcohol is high in calories and sugar and has a particularly potent effect on triglycerides. For supplements, I think our video last time about helping with lowering down cholesterol, like red yeast rice, omegas, and even niacin, are pretty good on this department. And for our IV therapies here, in my practice, we give what we call the Plaque X. Again, same as discussed from the cholesterol video, that this is a phosphatidylcholine based therapy, that it also stimulates the liver and also the other enzymes that breaks down cholesterol before it turns into plaque.
Yeah, thank you for all of that. And Plaque X, everyone, is one that it's a treatment I do a couple times a month, and it seems to be very effective. So we appreciate your insight and your knowledge on this, Doctor. That's Dr. Nario Biointegrative Health Center in Reno, Nevada. You can check them out online. Thanks for being with us.
Thank you, Steve, for having me. Always a pleasure. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.